Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become a better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
All right, guys, welcome back to WAAW Shout 94.7, the voice of the gospel truth. Guys, you've been listening to Help Matters, and we are back, and we have our special guest, Mr. Keith Richardson, Nobody Turned Down. And he's going to be talking about Medicare, and he's going to be breaking all the parts down. So you want to listen in and tune in, because this is very important, because we've been having a lot of changes in Medicare. So you need to listen to this. So if you don't, go back later and listen to it. Without further ado, we're going to introduce you, Mr. Keith Richardson, to Help Matters. Nobody Turned Down. Well, welcome, Mr. Keith Richardson. We're so glad to have you on the platform this morning.
Hey, how you doing?
Good. Thanks for having me. How you guys doing?
Awesome. I tell you, it's been a long time since we saw you. Last time we did a interview on the show years ago.
Yes.
So, it was real good. Very, very informative and a lot of knowledge on Medicare. So you introduce yourself to the people, let them know who you are, what you do, and then we're going to jump right into this interview, Keith.
Okay, you guys did a great job. My name again, Keith Richardson. The agency is called Nobody Turned Down. Like the name says, nobody's turned down. And, help out with getting your insurance, Medicare, filling in the gaps of Medicare, everything that encompasses Medicare and the extra benefits, like with medication costs, even telling you how you can apply for Medicaid. Some will get it, some won't, but that's what we do, is just trying to educate you and let you know what's available out there that you've worked for, that I like to say you're entitled to.
That's good, Keith, because I tell you, that process can be complicating and kind of scary to a lot of people. So how do you even apply for Medicare? What does that process look like?
It's two ways. Either it's when you're 65, or if you've been on disability for 2 years, not SSI, but disability. So let's say if you work so many years, you got the credits, and I don't want to say, let's say you mess up your hip, you can't hardly walk, and they say, well, you're on permanent disability, and you start receiving disability income, after 24 months, you will get Medicare, no matter if you're 25, 35, or 75. You'll get it that way. And the other way, like I said, 3 months before your 65th birthday, you need to reach out to Social Security and say, hey, I want to start taking my Medicare insurance, because my job, I'm going to be retiring from where I'm working. Or if you got like Obamacare, say, I need to use my Medicare, and then they'll get you set up with your Part A, which is no cost, and Part B, which it does have a cost, which everybody pays Part B premium. And from there, you got your Medicare, and then it's time to get that Medicare Advantage plan to start filling in some of those gaps, like with your prescriptions, co-pays, and things like that.
Well, I tell you, now you mentioned A and B. There's so many A, B, C's, and D's in that thing. Could you run down that list and the importance of it, and at what point we may need to get those different levels of Medicare?
So you automatically get A because you work, into the system, as we say. That doesn't cost. And what A covers is hospitalization, 80%. So let's say if you have to be hospitalized for no matter 1 day or five days, Medicare Part A is going to pay 80%. The other 20% is going to be on you. That's why you have to pick up a Medicare Advantage insurance plan to help out some of that 20% that Medicare don't. Part B, it covers like going to the doctor, 80% again. So let's say you go to your primary with a Medicare Advantage plan, you're not going to pay for that primary, but a specialist, you're going to have a small copay. So that's why you need the Part B to pick that up. Part C is the Medicare Advantage plan. That's when they'll try to trick you and say, well, do you have Part C? Yeah, I do. I got Humana, United Healthcare, or Aetna, whatever. And then Part D is for prescriptions. So the D is included. A, B, C, and D is all in one if you get an Advantage plan. So let's say you got your A and B, and now you need to get your prescription coverage. So if somebody called me, we sign them up for a plan, and that part C is going to be the Medicare plan from the insurance company, which is going to include the D for your drugs. So now you got A, B, C, and D, and you're covered.
Okay, so all of those kind of work together as a package once you apply for it.
Yep.
And then you'll get those plans, yeah. Because I tell you, so what if someone can't supplement Medicare with another healthcare plan or policy?
You mean because of the cost?
Yes.
Well, there's no cost for the Medicare Advantage plan. I haven't sold the Medicare Advantage plan with a premium in, I don't know, probably 10 years, because 99.9% of them are zero premium monthly. So that's not an issue. And some people say, well, I don't go to the doctor. You still have to have it, because if you don't or have a drug plan, Medicare will penalize you 1% of the national average of a prescription drug plan for the rest of your life. It could be $10, it could be $30, but that's a penalty. And I say, it doesn't cost. Just get it. If you don't go to the doctor, put it in your nightstand drawer. Don't worry about it. But it's better to have it and don't need it than need it and don't have it.
Mm-hmm.
I agree. So let's, Keith, can you talk about the elimination coverage gap, which is the donut hole? I was reading something about that, that. Can you explain that?
Good question. So this year, 2026, is really nothing. It's not a donut hole anymore. What they're doing is, once you and the insurance company have hit $2,200 out of pocket for your medicine. So let's say you're on Ozempic, and Ozempic is a very expensive drug. Let's say if it's cost $1,000, that's the true cost of it. The insurance says, well, you're going to have to pay $35 for your portion. We'll cover the rest. So that's going to add together. So now we're looking at still a total of $1,000 for that medication that you and the insurance company paid. So let's say if you have two other prescriptions, and they the same way, one of them may be $2,000, one may be $1,500, and your portion that you're paying could be $25, $45. Once the total, the insurance company and yourself hits $2,200, you will not have any more costs for medications the rest of the calendar year. And what I do is get your meds, put them in there, and I'll say, Ms. Jones, let's say if we started this in January, I say, Ms. Jones, come March 1st, you won't be paying for your prescriptions the rest of the year. You're going to pay $50 for January and $50 for February, but for March through December, you won't pay a penny.
Do you deal with a lot of veterans, Keith?
Oh, good question with that. Yes, sir. And see, a lot of the vets get their meds through the VA. So I'll tell them, I'm like, get your meds through the VA. If they're not costing you anything, we'll put you on a plan. There are two options. They have a plan called the Give Back. Well, vets can get, I think it's about $160 back in their check each month and still have benefits in the event they don't want to use the VA. Some say, well, I want to have everything. I don't like the VA. You can get a plan with, that covers everything as well. It's going to have the drug coverage, the dental, the vision, doctor's office costs. That one doesn't give money back to you because they're covering your prescriptions. And with the one that's an MA only, it doesn't cover prescriptions, but it covers everything else. Because they know a lot of vets say, no, I get my meds to the VA. I'm like, okay, keep doing it like that. We'll put you on this plan. So yeah, a lot of vets can take advantage of this. And I mean, a lot of them, they just get that money back in their check. They never use the insurance. They use the VA, which that's what they want you to do.
Now, I'm a vet myself, and I know a lot of vets know that they had to come off of TRICARE at a certain point. I think it is, if I'm not mistaken. Can you explain that process of how I think they had to go TRICARE for life or something like that?
Yeah, TRICARE for life is awesome. Anybody has it? What we do, we'll have to sign you up for a Medicare Advantage only, not a drug plan, because your drugs are already with TRICARE. They're going to interfere. So what we do is give you the backup that gives you, some of them have dental, some vision, the money back into your check, the gym membership. And that's what most of the vets want. If it's TRICARE for life, and even Champ VA, the same way, you show your TRICARE card and the Humana or United Healthcare card. And what it used to be that Medicare picked up what TRICARE didn't. Now it'll be Humana or United would pick up that cost that they don't. TRICARE picks it up and bam, it's covered. So if they had TRICARE for life, that's great insurance. I tell people, don't drop that TRICARE for life. You stay on it, and let's just add you a plan to put money back in your check, because TRICARE for life is awesome insurance.
Okay, awesome. Now, enrollment periods. If people miss enrollment periods, are there penalties for that or anything like that?
No, well, your initial enrollment period. So let's say if you were turning 65, let's say in June, you have 3 months prior to, the month of, and 3 months after. So let's say June rolls around, you hadn't done that, and we hit July, August, September. You try to sign up in October. You can, but you're gonna get penalized because you missed that window.
Mm.
So you got a 7-month window to get enrolled from the time you're 65 or your Part B. If your Part B says 6/1/2026, that means we can sign you up as early as March, April, May, June. Yeah, we can sign you up as early as March 1st to start June, or as late as July, August, September, as late as September. So I tell people, don't mess around and wait a year later because you don't go to the doctor and you don't use it. Now, if you're a veteran, you don't have to because you got credible coverage through the VA with everything. You're good. But if you don't, you better sign up because they will come after you and penalize you for that. It's called a late enrollment penalty.
Okay. And 65 is that golden age, as when you
Most people, 90, I would say about 90% people don't get until they're 65, unless, like I said, I get people who come out early. I'm 62. I'm like, sorry, you can't get Medicare until you're 65 or been on disability for 2 years.
Okay. Okay. So if they've been on disability for 2 years, then is there an age?
It's no age.
No age.
Yeah, I have people that are in their 30s, and people say, well, how they get in their 30s? I said, their disability. I said, I got people that, have HIV. That's a disability, and they got it. I got people that have like lupus and cancer and real serious stuff, and they are deemed disabled, and they'll get their disability. And sometimes they'll backdate it. If you've been sick, let's say a year, that in the records it shows that this person has had this diagnosis for about a year and a half. And you know what I mean? Now they're 3 or 6 months out from getting that Medicare. So yeah, you can get it. It's just you got to win the disability battle first. That's the hard part.
Okay. Okay. So the difference between Medicare and Medicaid, Keith, could you talk about that a little bit?
So Medicaid this is how you qualify. It's based on income and age. So let's say if you are 50 years old, A, you got to be on disability, and B, they're going to look at your income. So let's say if you say, well, I only get $800 a month for disability, I'm 50 years old. I'm not going to guarantee you, but you'll get Medicaid. Excuse me, 9 times out of 10, you're going to get that Medicaid because the limit is like $1,000, $1,300 for income. And if you're 65, you don't have to be on disability. It's just the income. So let's say you're 65 years old, you only get Social Security, again, $800 a month. You only have one car, one house, and you don't have no 10 or 15,000 in the bank, no stocks, no 401k. You're more than likely get that get that Medicaid. But you can't have a rental property, 3 cars. Because I get people who say, well, yeah, I got my dad's old car. When he passed, we just took it in the backyard. It don't run. It's on blocks. I'm like, but it's titled to you, so you own that. That's property. And as long as it's in your name and you paying taxes, that's your property. So either get rid of that stuff, don't hold on to stuff like that, because they don't know the car don't work, but that's a rule. You can only have one vehicle, one house. They're strict on that income.
Now, you may have said, what's the primary purpose for Medicaid?
Now, if you get let's say you got your Medicare and you get Medicaid, you can get, if it's the right level, you pay nothing for medical services. I'm talking, you can go to the doctor every day. You can go to the hospital every day, surgeries, procedures, tests, diagnosis, therapy, no cost. Okay. The only thing you'll pay for is some of your medications. You're going to still have a slight cost, but they're going to be so reduced after maybe a month or two, you won't have to pay that. You may pay $15, $20 for those meds if you're on a lot. And the dental and vision, they don't give you unlimited. They'll say, we'll give you $3,000 worth of dental, $300 worth of vision. But everything else medical, like if you got to go into a skilled nursing facility, you don't pay for it. No matter how long you're there, you're good. If you're in the hospital, you're good. You don't pay for any of that. So that's the thing with Medicaid. It really helps a lot of people who they don't have the income. I get a lot of calls about that. It's like, I can't afford, I got to have a surgery and it's going to cost me X amount of dollars. Medicaid will pick that up for you to 100% if it's the right level of Medicaid.
So Medicaid primarily focus on low income?
Yeah, I don't like to say that because, but technically that's what it is. It is lower income people. You can't be knocking down $1,800 a month as a single person. You're not going to get Medicaid. Or let's say a husband and wife, you totaling up to be about 2,500, 3,000, you won't get it. But there are situations where I got a husband and wife both get it because their income is very, very low. Okay. But it is for lower income people, that lower poverty level people who can get that Medicaid.
Okay. So Keith, instead of keep asking your questions, just go ahead and share, with the people, what's on your heart, what you want the CSRA to know, Georgia, Carolina, about your business, how to get in contact with you, things of that nature, and anything else you really want to get out while you are speaking to the CSRA community.
Okay. One of the biggest things I've been seeing is, you guys everybody wants this food card. You got to qualify for it. And it's not for everybody because some people will take a $50 food card but have higher office copays. That makes no sense whatsoever. We'll get you food from a pantry if that's what you need. So let's focus on your health care, keeping your health care costs down like copays. And another thing is we call it filling the gaps. So a lot of people say, well, hey, I got my Medicare plan with United and Humana. I'm good. No, you're not, because if you're hospitalized without Medicaid, you got to pay those days in the hospital, which could be anywhere from $300 a day to $500 a day.
Wow.
You got to pay for surgeries, like an outpatient surgery. If you have to do rehab, you got to pay those costs. If you got to be in a skilled nursing facility after so many days, you got to pay that. What if you suffered a heart attack or stroke or cancer? Mm-hmm. That could bankrupt a lot. Of cancer medication can be expensive. So what I do for most of my clients is we got a plan. We call it filling the gaps. We'll say, hey, we're going to get you $5,000 for cancer. We're going to get you cover your hospital days if you're in there. We're going to cover a surgery cost, so much to cover surgery, whatever. Let's say if it's $300 to get an outpatient surgery, we'll get you $300 that you can use twice a year if you had to have that surgery. If you say, hey, what about home health? If I need somebody to come in because I busted my hip, we'll sign you up with a plan. That's the stuff that people miss. They need it. And Medicare is going to give you so many days, but they're not going to give you like unlimited. Mm-hmm. And I tell people, spend the money, get the plan. It's a peace of mind, but that's what we need. So we're not sitting there like, man, I got cancer, which I'm in chemo and recovery, but my cancer meds. Or what if you got to pay somebody to come and sit with you or to run you to the store or go get groceries? Family, you know how family goes. They'll do it for once, twice, but you may need this for a couple of months. And this is money paid to you. If you got a cancer policy, that's money paid directly to you. You do what you want to do with that money. So that's a big thing that I want our people to start focusing on, is filling in those gaps, because that can hurt you. A hospital stay could end up costing you $1,000. Now, maybe to me and you guys, that may not seem like a lot, but somebody who was only getting $900 a month, that's a lot of money, right? That's a lot of money. And they panic, and these bill collectors, they call you and scare you, and you shouldn't be living like that. So that's what I stress to people. Let's do it. They're not that expensive getting these policies, but it's a peace of mind.
Mm-hmm. So how do I get with Keith Richardson and nobody turned down?
I'm gonna give you guys the number. It's the South Carolina number, which you can reach me. It doesn't matter if you're in North, South, or Georgia. It's 803-281-6600. And this is the biggest thing, guys. If I don't answer, leave me a message. I get calls all the time while I'm on the phone with somebody. They'll call, won't leave a message, and I can't reach them back. So leave me a message if you can't get through, or they can visit the website, nobodyturneddown.com. And shoot me a message. I'll call. And I'm like this. If you call me today, unless it's late, I'm going to call you back. You're going to get a phone call, or it'll be first thing in the morning. I say, hey, I missed your call. This is Keith. What's going on? I don't play that, call you back in 2 or 3 days, because I don't know what's going on.
Right.
You don't have to be one of my members. I will still help you. I don't say, well, I didn't sign you up, Mr. Jones, so I can't help you. No, what's your question? How can I help you? Okay, this is what we need to do to get you taken care of. It don't matter if I'm not your agent. It's all about helping and educating. I don't care about the money will come. I tell all these other agents out here, you'll get the clients and referrals. You take care of people and do right by them. They'll refer you.
Right. I agree with you, Keith, on that one.
That's
Well,
what
hey,
matters. Yeah,
Yeah.
that's what matters. People
Yeah,
don't
that
care how much you know.
so
They
till you show how much you
care.
care.
that's
And
right.
sometimes you just have to when you just going above and beyond for someone.
Right.
And now, hey, I didn't gain this person as as a client, so that's good. And I know my husband would be what 62 this year. I would be 60. So we're getting ready to,
Right.
head down there. So we need to know this information, and started educating ourselves more. And I work with seniors. I work with senior facilities, so they really need to be educated on this, and could they get taken advantage of? And I want to be able, as long as I'm competent and got someone to help educate them, I
Right.
want to do that.
Right. And another thing that, in our Black community, we don't do this. I mean, I know you guys have seen it millions of times. How many times has somebody passed away and you got to do a GoFundMe, a cookout,
Right.
Yes.
Right.
we got to stop that and get life insurance. Life insurance is a benefit that can be passed on to the next generation.
Generation.
I tell
Yes.
people, get you some life insurance. What are you doing for your will and your trust when you pass? What's going to happen to yourself so it doesn't hit probate? Let's look at your retirement. Let's look at the big picture and see if we can fill those gaps and say, you know what? You got a 401k, you're leaving the job. Let's see where we can put that 401k money and make more money where it's going to be safe. You're not going to lose it. Well, how about let's get in a life insurance policy to cover a husband and wife? So when the husband passes, the wife got money, vice versa. But we don't do that. But as Black people, we got to start having that game plan. And, I love to look at what you have. Like you said, this is what I got for life insurance on the job. But when you leave the job, that insurance is gone. You have
Yes.
nothing, and you're 65, and you're starting all over again instead of getting you a policy now. When you do retire, walk away, I'm covered. I don't have to worry about that because that's term insurance on the job. You want something with a cash value. If you needed to borrow money from it, it's going to grow. And then let's say in 10 or 15 years, income is there that you can pull from it for a retirement source.
Mhm.
And that's the thing our people are not educated about. And I try to educate them and tell them, you need to look at the big picture on this stuff.
Awesome.
Yeah, that's good.
And we definitely need it. So Keith, thank you so much, man, for
Yes, sir.
for bringing this wealth of knowledge to the CSRA community on this morning. And we'll get together and we'll chop it up again because we need to continue to be repetitive as
Yeah.
it pertains to helping people.
And
So
continue
we'll
to
get you
educate.
back on the show again.
Yeah, continue to educate the community, and we want to, from Coach Patrick and I, we're so grateful that you chose us to sponsor us. We appreciate you so much because this is part of what we do. They matter, they help matters, and we want to make sure. that
Yeah,
people
you
get
guys, anytime, call me. Like I said, any questions, shoot me an email. Tell me about this, tell me about that. I have no problem helping out. And if I don't know, I'll get the answer for you guys.
All right, we
All
appreciate
right.
it.
Thank you so
All right.
much.
All right,
Okay.
well, be blessed. Have a great day.
You too. Take care.
All right.
Bye bye.
Awesome. Mr. Keith
Awesome.
Richardson
Yes,
of
yes.
Nobody Turned Down. Again, that number, if you want to get a free Medicare checkup and make sure that you're in the right Medicare plan, you need to call 803-281-6600. That's Mr. Keith Robertson at nobodyturneddown.com.
And yes, and he's like you said, you don't have to be a client. He may not answer the phone right away, but he will get back in touch with you because there's so many changes that is taking place,
A lot of
Coach. And
changes,
like I
yeah.
said, we're headed in that direction, and we need to understand this. There's so
Stay
many
abreast.
things that have been added to this,
Mhm.
and I see a lot of older people now is being taken advantage of, and so we got to understand this stuff. Like I said, we're in that kind of in that
Right.
boat.
Most definitely.
So we got to be educate ourselves, and like you said, generational wealth insurance policies. So we shouldn't have to do, like I said, go fund. People got to do what they have to do,
Gotta
but if
do it,
we
yeah.
prepare,
Mhm.
ourselves, it'll be much better for our family and not so much a headache on our families.
And that's what it's all about,
Right.
preparation. All right, guys, listen, our time is up. We want you to stay tuned for the Concerned Minister Fellowship. You Matter. Pastor Bush is coming up right after us. And then at 10 a.m. Saturdays with Sean is coming up. Midday Motivations at 11 a.m. with Alicia G. and Tony D later on this evening at 6 p.m. with the New Artist Profile. Our weekly programs, Pastor Small, Morning Praise Devotion at 10 a.m. Monday through Friday. Community Matters, Mondays at 11 a.m. And then Sister Mary Harris with Afternoon Praise Cafe at 12 p.m. Monday through Friday. Minister Arlene Edwards is Talking It Up, 3 p.m. Monday through Friday. Reginald Forrest on Education Matters Tuesdays at 11 a.m. And Pastor O'Neill is Transforming Lives Thursdays at 11 a.m. And then you have Sister Gwen Smiles and Pastor Smile again with Community Matters Fridays at 11 a.m.
And guys, we always like to thank you for listening to Help Matters here on Shout 94.7 FM. We like to always leave you with our verse, 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Remember, we are here to help you to become a better you, to be the best you that you can be. Always remember, show an act of kindness, because you never know when the act of kindness may be extended back to you. We at Help Matters here, we love you. Remember, you matter and your help matters. We'll see you again next week.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goals.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.